Good morning, everyone. Welcome back. Thank you for joining us. I'm glad that you're here. I'm Steve,
And I'm Scott.
and we're the Science and Technology channel, Backyard Musings.
Yep. And today we're talking about health and specifically about dental health and how it can affect your body. And this is the real deal.
Before we launch in, I'd like to ask each one of our subscribers that's watching this video, this is a pretty good information about dental stuff. I'd like to ask you, find one person and send one of our videos to them and get them to subscribe. If you do that for us, we'd really appreciate it. That would
be awesome.
Subscribers.
That would really be awesome.
We're just asking for one. Find one person.
Yep. Just send it to a friend or a family member or whoever. Yeah, that would be awesome.
Okay, here we go. Successful root canal treatment may help lower inflammation associated with heart disease and improve blood sugar and cholesterol levels. Wow, okay. Root canals, bring them on. Treating an infected tooth with a successful root canal procedure may do more than relieve pain. And let me tell you, I've had pain from a root canal that I couldn't get to until Monday, and it started like Friday, and it brought me to tears, a grown man. That's how bad it was. New research suggests it could also lower inflammation tied to heart disease and improve blood sugar and cholesterol levels. Would you like to know more?
Yeah, the heart disease and blood sugar levels or cholesterol levels that's something that everybody should be interested in, right? And who would think gum disease and your teeth would affect that? But it's all part of your blood flow and stuff. So anyway, in a first of its kind clinical investigation, researchers at King's College London monitored changes in blood chemistry after patients received treatment for a common dental infection known as apical periodontitis. This infection occurs when bacteria invade the root of a tooth and surrounding tissue. If left untreated, bacteria can enter the bloodstream, trigger inflammation, and potentially raise the risk of cardiovascular problems while also interfering with the body's ability to regulate blood sugar. So some big deals there. You don't want to mess with your cardiovascular system. So
if you look at the screen right now, you'll see that tooth in the middle, and this is what it's like a circular. I mean, bad stuff gets into your blood system and start to affect other parts of your body. So you got to take care of this.
Yeah, it's really similar to some cancers, right? If you don't take care of the cancer right away, it starts spreading. And before you know it, it's out of control. And I think that's kind of the same with this issue here.
Yep.
I mean, nobody knows, and well, unless you're a doctor, probably, or you specialize in this stuff, but nobody knows how your blood flows through your body and what gets taken what and where. Our son, years ago, when he was a kid, he was about 10, he had a blood infection. And we didn't think anything of it. We thought he was faking it at first when he said his foot hurt. And we took him into his pediatrician, and they dialed in it right away. And I mean, before you know it, he was on IVs. And they said if you hadn't taken care of this right away, it could have affected him terribly. So you don't mess with that kind of stuff. Infection is the real deal. So
anyway. Although previous studies have linked dental infections to broader health concerns, no research has directly examined whether successful root canal treatment could produce measurable improvements in the heart and metabolic health. This study set out to explore that responsibility.
The team discovered that successful root canal treatment was associated with healthier blood sugar control. Over the 2 years following treatment, patients showed a meaningful decline in blood glucose levels, an important step in lowering the risk of developing diabetes.
Stronger cholesterol and fat balance. In the short term, levels of blood cholesterol and circulating fatty acids improve, both of which play a central role in maintaining heart health.
Lower levels of inflammation. Biological markers associated with inflammation, which are commonly tied to cardiovascular disease and other long-term health conditions, gradually decreased. This is all good news.
Yeah, system-wide metabolic effects from oral bacteria. Microbes originating from infected teeth were linked to measurable shifts in the body's overall metabolic processes, suggesting that dental infections can influence more than just oral tissues.
Root canal infections can cause bacteria to enter the blood, leading to inflammation, heart disease, and diabetes risk. Successful treatment reduces these risks. The study, published in the Journal of Translational Medicine on November 18th, 2025, followed the health of 65 patients from Guy's and St. Thomas NHS Foundation Trust over 2 years after root canal treatment. Scientists analyzed molecules in the blood of patients to reveal how the body processes sugar, fat, and other key substances, and responds to disease and treatment. They used a technique known as nuclear magnetic resonance, or NMR, spectroscopy, used to analyze proteins in the body.
The findings suggest that monitoring blood metabolic markers such as glucose, fats known as triglycerides, and the protein tryptophan could help assess recovery and risk after dental treatment. Lead author Dr. Sadia Niazi, senior clinical lecturer in endodontology, King's College London, said, quote, "Our findings show that the root canal treatment doesn't just improve oral health, it may also help reduce the risk of serious health conditions like diabetes and heart disease. It's a powerful reminder that oral health is deeply connected to overall health."
This is a quote, probably from the same person, I would think. Long-standing root canal infections can allow bacteria to enter the bloodstream, trigger, inflammation, and increase blood glucose and fat levels, raising the risk of serious health issues like heart disease and diabetes. It is vital that dental professionals recognize the wider impact of these root canal infections and advocate for earlier diagnosis and treatment. I agree with that.
We're going on with a quote. We also need to move towards integrated care where dentists and general practitioners work together to monitor the risks through these blood markers and protect overall health. And just as an aside, I wonder if there's like a rivalry between dentists and medical general practitioners.
You mean You mean when somebody gets sick? Well, did you just have dental work done?
No, like a rivalry, like a medical doctor saying, "You're not a real doctor, dentist."
Oh,
something like that.
Well, we know a couple of those we could ask. So
it's time to move beyond the tooth and embrace a truly holistic approach to dental care.
While more research is needed to confirm these effects in larger populations, the study opens exciting new doors for understanding how oral care can support general health and well-being. So, yeah, I've heard about this for a long time. I forget what happened. I went to the doctor for a cold or something, and that was one of the questions that I was asked. When was the last time you went to the dentist? And I had just been. And they said, well, you never know. This could have been an infection from a dirty tool or something on the gloves of the hygienist that was working on your teeth. My cold cleared up and all that, but I'd never had that question asked to me before. But then something like this comes along, and it's the real deal. So,
yeah. I was just at the dentist today. Had 2 crowns put in. I had temporaries for about 2 weeks.
How'd that go?
They went in fine. They said I can't chew for 24 hours. I told them, okay.
So what are you doing? Are you pulverizing and mixing up your steak? Is that what you're doing? So
well, I have my wife chew the meat and then give it to me, and I just swallow it.
Okay.
I've asked her to put like barbecue sauce on it, but she won't do that.
Too much information.
All right, folks. Thanks for joining us.
Please join us tomorrow, even despite Steve's last comments. See everybody tomorrow.